Alrighty, guys. So we are live, and it's time to study for Adult Care Exam 2. Alright, first off, we got the endocrine system. Okay, so we're going to talk about the endocrine glands, hormones, and its effects, okay? We're just going to go over this real fast, okay? So we got the pituitary gland that stimulates the release of the growth hormone, cortisol, T3 and T4 release, and also regulates water balance. And then we have our thyroid gland, which also releases T3 and T4, deals with metabolism. And your thyroid gland releases calcitonin, which lowers calcium. Okay, parathyroid releases PTH, which raises your calcium levels. Okay, so parathyroid for PTH, which raises calcium. Thyroid for calcitonin, which lowers. Thyroid lower, parathyroid raise of calcium. All right, adrenal cortex. We have cortisol. So, stress, glucose release, and also aldosterone. So that's your sodium and potassium balance. Alrighty, and then we have our adrenal medulla, which is our epinephrine and norepinephrine. And then pancreas, which releases insulin, which lowers the glucose, and then glucagon, which raises your blood glucose. All right, and then in females, we have ovaries, which release estrogen, and then testes in males, which release testosterone. Okay, so here's an example of a negative feedback loop. Okay, so your T3, T4 is too high, so TSH decreases, right? Your T3 and T4 is low, TSH increases. So basically something's out of balance and some other thing is released to balance that out. Yeah? Okay, so we're going to go on to dietary recommendations. Okay, so if you have diabetes, you want to go low carb, high fiber, and avoid sugar. So basically keto, but they're not going to label it like that. And then hypothyroidism, we're going to want to increase iodine, selenium, and avoid, I can never say this word, the goitorgans for hypothyroidism, okay? Hyperthyroidism is going to be high calorie, high protein. Okay, Cushing syndrome, we're going to go low sodium, high potassium, high protein. Okay, Addison's, low sodium, high carb. Who would ever want high carb? Apparently Addison. Okay, so Addison's, high sodium, high carb. Hyperparathyroidism. Okay, low calcium, because remember, your parathyroid is the one that releases PTH, which increases calcium. So if you have hyperparathyroidism, you're having too much calcium being released, so you want to not eat calcium. Okay, hypoparathyroidism, you want to eat that calcium and vitamin D because your parathyroid is not working. All right, on to endocrine disorders. We have hypopituitarism. Okay, so this is caused by tumors or head trauma. Some symptoms are fatigue, infertility, hypotension, and labs, it'll just be wacky hormone levels. Your treatment is hormone replacement. Woohoo. Alright, so hyperpituitarism, which is acromegaly or Cushing's, usually caused by a tumor or excessive growth hormone or HCTH. Okay, so symptoms are enlarged hands and feet, moon face, hyperglycemia. That's an important one. Hyperglycemia. So labs are going to be high growth hormone, high cortisol. Remember, high cortisol causes extra glucose to be released into the blood. And there's a treatment for that is surgery, medication, radiation to get rid of the tumor. Hyperthyroidism, we have Graves' disease and thyroid storm. It's usually caused by autoimmune disorders or stress. Okay. Hyperthyroidism, you have heat intolerance. So think like hyper, more energy. I don't know. I'd think of hyper hot. Like, I don't know. Hyper for hot. And so you have heat intolerance, you have tachycardia, everything's speeding up. Think hyperthyroidism, everything's speeding up. So you have heat intolerance, you have fast heart rate, and since everything's speeding up, you're losing weight. And you're going to have low TSH and high T3, T4. Okay. All right. And then for treatment, you have beta blockers. Those are just like not really a treatment, but that's just to get rid of the fast heart rate. So beta blockers, anti-thyroid meds, and then surgery, radiation. So, or actually RAI, I don't know what that is actually. RAI? Oh, radioactive iodine. Yeah, that's right. Radioactive iodine. Okay, so on the opposite spectrum, we have hypothyroidism or myxedema coma. It can be caused by Hashimoto's or an iodine deficiency. So with hypothyroidism, you're gonna have cold intolerance. You're having slowing down for slow hypo, so cold intolerance, bradycardia, and you're slowing down, so you're gonna have weight gain. Okay, you're gonna have high thyroid stimulating hormone. Because think about it, your thyroid is not reacting. Your thyroid isn't reacting, so the body's like, I need more thyroid stimulating hormone. So it goes and it drops thyroid stimulating hormone all into the body, but your body isn't responding. It's like a diabetic person, or a type 1 diabetic. Like, they have insulin, but the body's like, that's a lie. It's like type 2 diabetes. Your body's producing insulin, but your body won't use the insulin because it's insulin resistant, okay? So same thing with this. So your body's producing a lot of thyroid stimulating hormone, which is TSH, and the body won't use it, okay? So, and then we're going to have low T3, T4 because the thyroid isn't, producing it, okay? All right. Treatment is this drug called levothyroxine, and also apparently drinking warm water. Okay? All right. Thyroiditis. Okay, so this can be caused by infection, or it can be autoimmune disorder. Okay, so think itis, obviously like infection kind of thing, itis, infection. So you have an infection of the thyroid, okay, pain, swelling. You can also have hypo or hyperthyroid symptoms, okay? So labs, you're going to look for the thyroid stimulating T3, T4, and also probably white blood cell count. Treatments are NSAIDs, steroids, and thyroid medication, depending on if you're hypo or hyper. All right, thyroid cancer. Wonderful. So genetics, seed oils. Did I say seed oil? Oh, sorry, excuse me. They don't talk about seed oils. We don't talk about seed oils. Not in nursing school. Okay, so seed oils, radiation, genetics, maybe genetically modified. I'm just kidding. Sorry, just genetics. You didn't hear me say that. So some symptoms, you can have a lump, like a little lump in there. You can have trouble swallowing because your neck's like you got like these things coming out right here because like your thyroid's all like, so you can't swallow. And also your voice is like, because you can't talk because like you got cancer on your thyroid. All right, so labs, thyroid function, and you can also do a biopsy. That's not sketchy at all. All right, treatment, surgery. That's not sketchy at all. Definitely no risk associated with surgery. Also, radioactive iodine and chemo. But we won't talk about prevention because we make a lot of money when you come in and need that surgery. All right, moving on. La la la. Hyperparathyroidism. Okay, remember hyperparathyroid. We have some calcium imbalances. All right, some risks for this are having a tumor on your parathyroid or kidney failure. Okay. Symptoms. Okay, so think about parathyroid releases calcitonin. Sorry, regulates calcium. Okay, so parathyroid releases parathyroid hormone, which raises the calcium. I got that mixed up. Thyroid releases calcitonin. So parathyroid releases PTH, which raises the calcium. Okay. So we're gonna have hypercalcemia. We're gonna have kidney stones because remember, kidney stones are made out of calcium. Fractures because the body is pulling the calcium from the bone into the bloodstream. Okay, labs, you're gonna have super high calcium. You're gonna have low phosphorus, and you're gonna have high PTH. All right, we got surgery, drink lots of water, and take calcitonin. Good job. Okay, hypoparathyroidism. Okay, risk, surgery. Like, if you have the surgery, and then they nick it, like, you can, like, your parathyroid can, like, die from, like, nicking it. That's why surgery is so risky. So, if you get a surgery on your thyroid and they nick the parathyroid, I'm sorry. Yeah, that's sad. So, or autoimmune disease, or on autoimmune. So, say no else. Vaccines. Unorganic food. You didn't hear me say that. Okay, so some symptoms. Obviously, hypocalcemia, because if your parathyroid isn't releasing PTH, then your calcium levels are going to be low. And also remember, think calcium, think seizures. So seizure precautions, maybe, if it's bad enough. All right. So for hypocalcemia, you want to check for Trousseau sign. And also, whatever this is. Oh. Yeah. Okay, so tetany. Tetany? I think that's how you say that. Tetany? I don't really know. Tetany? That sounds super weird. Basically, where your muscles involuntarily contract because they're overstimulated by peripheral nerves. So basically, low calcium causes that to happen. Okay? Very good. You're so smart. I'm so proud of you. Okay? So, remember, hypoparathyroidism, hypocalcemia. Hypoparathyroidism, hypocalcemia. Check for Trousseau. So, labs, low PTH, low calcium, high phosphorus. Treatment, take calcium, take vitamin D. I'm sorry if you had surgery on your thyroid and they nicked your parathyroid. Pat. I really am sorry. Like, I really am. I'm, like, not joking. Okay, some education for radioactive iodine therapy. Do not take this if you're pregnant or breastfeeding. Just don't do it. Don't ask me why, but don't do it. Okay? You don't want to be around other people because you're going to make them be exposed to the radiation. That's not nice. You trying to kill other people too? No. Keep that radiation to yourself, okay? All right. Use separate utensils, and you want to flush your poo and pee twice because that stuff's radioactive. All right. Some surgeries. Okay. Let me pull up my list here of surgeries. My bad. Okay. All right. Hypophycectomy. All right. Pre-op. Nasal packing education. And then post-op, elevate that head of the bed and monitor for, I forgot actually. Let me just look it up really fast for you. Oh yeah, monitor for your cerebral spinal fluid leakage. All right, thyroidectomy, you want to stabilize, pre-op, you want to stabilize the thyroid, post-op, maintain that airway, and monitor for hypocalcemia, because if you think about it, you're removing the thyroid. Okay. All right. parathyroidectomy. Stabilize that calcium, okay? Post-op, monitor for hypocalcemia. Monitor that airway. Airway. When in doubt, ABC. Great, and that's it for endocrine. So we're going to go ahead and end the live stream and then redo one for diabetes.